That's righty. Somebody says, hey, you've been running this for 21 years? All by His grace. We call it Ultimate Health on Joy 99.7 FM. Yeah, some call us a frequency, I call it a family.
You know it's another OPK classic.
Some say it's a program, I say it's a promise. For 21 years, if it impacts on your health, your well-being, we will definitely talk about it. Today we continue our discussion with Rose Edufo of the Kolibut Teaching Hospital Center for Reproductive Health on cervical cancer. We're zooming into preventive screening, vaccines, tests, treatments, and beyond. We'll try and do all that and still have fun. Read your messages and all that. You know it's a family. So once again, welcome aboard Ultimate Health on Joy 99.7 FM. Auntie Rose.
Nortey.
How now?
Very good.
Charlie, you've changed the satellite dish.
You know right. You know right.
My head is one.
For us, we can change it anytime we desire.
Hey,
that makes us unique.
Into a screensaver. We will get to desktop. This is the screensaver. But once again, folks, I have Rose Edufo. She's a principal nursing officer with the Kolibut Teaching Hospital Center for Reproductive Health and Family Planning. Yeah? Okay. Doesn't mean men are not welcome. Please, don't get it wrong. Okay? They are. Sure. Right? But they like that designer excuse. We'll get there one of these days. Very soon, I'll bring your sisters in. Teresa and
I seriously have missed
and
them.
Doris. The three of them are my Charlie's angels when it comes to sexual and reproductive health. So we'll be doing that soon. So yeah, thanks for coming again.
Thanks for having me.
Last week we talked about cervical cancer. We were able to locate it, describe it, and link it strongly. Let me just lower my music. Okay, there we go. Link it strongly with the HPV virus. Okay?
Sure.
And establish also that the transmission of that, should I say, bad virus when it comes to cervical cancer is sexual. Right?
Exactly.
Okay. And HPV is quite highly prevalent. Most of the types our body will fight anyway and will not even know about
at all.
Okay. And then, of course, there are two telltale strains that lead to or are strongly associated with cervical cancer.
Perfectly.
Right? And then, once these, should I say, processes take place, there'll be certain noticeable changes that can be detected even before the cancer stage.
You're very right.
All right? Therefore, screening is important.
Very necessary.
Screening is important. Screening doesn't mean you have it. It's important.
Very, very
okay.
necessary.
Right. Teacher, please take over. What have I left out? I know we did signs and symptoms, regular bleeding, discharge, and many other things, right? Risk factors, multiple partners, early onset of sexual activity, not sexual intercourse, activity.
Very necessary.
When Rose and I are talking, we are specific, especially when it is the physically do. Right. Did I leave anything out?
You have done well. Look like you have virtually touched every area that we looked at. Sure.
Right. But listeners, if you have any questions, concerns from last week or even straight off today, please, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube, and we mean business, especially when it comes to cervical cancer. If I just remember, 2,900 and something, almost 3,000 women every year, annually, are diagnosed with cervical cancer.
And
Annually,
about 60% are dying.
Annually, we lose almost 1,700 annually. All right. and these are women we know. Okay, so we need to take this seriously and not joke with it at all. Yes, over to you, Rose.
Right.
So screening, early detection is key. Sadly, last week, Mr. Kwesi Finn called in, or we called him, and he courageously shared his story.
Yeah.
Right? His wife was diagnosed in 2020. Very quickly, he lost his wife. Right?
Within 2 years of marriage.
Within 2 years of marriage.
Yeah.
Okay. And the progression was rapid.
Very.
Okay. So we know there's screening. So we'll be talking about that in detail today.
Sure.
And then the possible outcomes and follow-ups of screening. Okay. If something is found, what happens?
What happens? Great.
Right. And then we talked briefly about vaccines.
Perfect.
Right. Vaccines suggest that you've had a clear screening. You are within a certain age group, and therefore you are a candidate for vaccination. Okay.
Exactly.
Yeah. Okay. Right. So let's start with screening. We encourage women, and I know you got your discounted screening ongoing this month.
In fact, starting from tomorrow, God willing.
Starting from tomorrow.
Tomorrow through to 30th April.
Okay. Discounted.
Highly discounted.
Screening.
Sure.
Okay. Let's recount what screening is. What are we doing?
Right. So, good afternoon once again to wonderful people who have been with us from last week through to today. When it comes to every disease prevention, there are what we call the primary level. The primary level, which means that, yes, before the person gets exposed to the causative organisms, you try to protect the agent or you truncate it so they don't get infected.
Primary prevention. So you don't have it, and we're making sure you won't get it.
You don't get it at all.
Primary prevention.
Great.
Okay.
And then it comes to now I have been exposed either way. So what do I do to ensure that I don't get the disease? So this is what we call the screening.
Okay.
And for cervical, because we are talking about cervical cancer, because we are talking about the cervix, the mouth of the womb, usually the test is done on the mouth of the womb to help us to ascertain whether or not you had a pre-cancer lesions. The screening is not testing for cancer cells.
Okay.
We are testing for before
Changes in your cells.
Changes that could be prevailing or present on the mouth of the womb before any cancer sets in.
Okay.
And like we mentioned last week, that the transitional period could go as long as 10, 15, 20 years before one would even exhibit the symptoms or the signs that has to do with cervical cancer. And so there are quite a number of the screening approaches or tests that could be done. And I'm excited that it doesn't matter where you find yourself, as in whether your economic status is high, the social settings. Any service or any form of the screening at all can be helpful for you.
Okay.
The first one that I want to talk about is the VIA, which has so much been, a lot of work has gone on to help especially those in the peripheries who do not have the other logistics that can take care of the advanced level of screening. And this one is just an instant test that is done. So VIA, visual inspection with acetic acid.
Thank you.
Sure. So that we use, the woman is positioned in a way that we can have access to the service. We open the service using an instrument, and then we use acetic acid, domestic vinegar, to wash the place to see. So whilst we're washing, we're trying to assess under a particular to say that like a microscope to say, so that we can appreciate any changes that could possibly be there, so that if you notice that yes, there are some patches that are prevalent
abnormal
or present,
cells will react to this vinegar differently.
Perfectly. It becomes kind of white patches that could be on the service. And so the provider is able to really tell that, okay, this is normal, this is abnormal, and so I have to go further to do other interventions to prevent so the woman from getting the cervical cancer. And I want to emphasize the fact that even at this point, we have not yet said you have cervical cancer. We just don't want you to get the disease. And so that is what we are doing here. And so the times that when the woman is, when the screening, the VIA is done, and there are some changes, then the next thing the provider does for you is to do what we call the cryotherapy.
Right.
So the affected area will be frozen to say with either the carbon dioxide or nitrous oxide to ensure that that affected part is highly exposed to the carbon dioxide, and then we allow a space of about, some protocols do a week to 2, others will do 2 weeks to 3 weeks for everything to thaw off, so that abnormal cells will be off, and then you continue with your routine screening. So that is very instant, and it is not expensive.
I haven't heard a common word that comes up in most people's minds, pain, discomfort. You make it sound so come in there, we're putting you in a position, and then we expose the cervix, and then we brush it with vinegar. Is there any discomfort, anything that women should know?
Sure, because
and again, before you continue, can any woman, because we're talking about a broad spectrum of age range, right, just do this VI? Is it good for everybody?
Okay, great. So a lot of the times, before I come to the age, I want to talk about the fact that yes, naturally anything that goes to our vagina, that goes to the vulva, is quite sensitive. We see it as private. And so the mere fact that somebody you didn't know from Adam is asking you to please undress, to lie on the bed, there has been series of experiences. Women will say, some through labor, some through other means, and they have not been too pleasant. And so there are some, even when you ask them to take that position alone, you need to do a lot of psychological preparation to allay their fears and anxieties on that. And so that discomfort can be there. And then again, we try as much as possible to take some history so that we would even know the size or shape of the instrument to introduce in. We have the baby speculum, very tiny instrument that can be used.
So when you use qualifier like baby, you're talking about sizes.
Yes.
Please. Right.
Great. So that at least we would reduce the level of discomfort that the woman may experience. And then we have the medium size and then the large size. And so these are some of the instruments that we do.
All right. Just a bit there. So who is doing that with the baby, medium, or what? Who is it? A nurse? Is it who does this? Who's supposed to do this?
Great. So this is a professional trained, be it nurse or a doctor.
Right.
So you have to be trained before you can come.
I know the midwives were trained to do this.
Yes. So the midwives in their general field know how to use these instruments. But when it comes to now with the cervical screening, you need additional knowledge to help you to train on that.
All right. 20 minutes past the hour of 2 on Joy 99.7 FM. 4th of February already. And we're still talking about cervical cancer awareness, preventive screening. What are we looking for? How are we looking for it? And what does it mean if we find anything? And what does it mean if we don't find anything? Questions, concerns, experiences, welcome on WhatsApp 055 11 11 997. Abeku tells me it's a bit slow. We're live on Facebook and YouTube, and I'll activate the phone lines earlier so that you can get access to Rose. And, brush hair with some vinegar, right? Okay, so,
Great.
So this is a professional doing this.
Sure.
Okay.
Sure.
Yes. Then nobody should convince you that, I have some kiosk here or somewhere. I've also learned the VIA, and I'm now brushing women with all sorts of things I claim to be acetic acid, and it's cheaper.
So it is cheaper, but you should ensure that you get this service from a very...
You need to be safe.
Professional space. So currently I know Ridge does. Ridge has been doing this for decades.
Centuries.
And then I like that, centuries.
Kumiwa Doris, I greet you.
Same here, dear.
Kumiwa Doris.
My boss. And then Dansoma Hospital, Dansoma Polyclinic also provides same service. And a few others. But I know to a large extent.
Don't leave Kolebu out.
Kolebu.
Are you not doing VIA?
We are not yet doing VIA. We're going to start because
Wasn't
of
the Polyclinic doing it, no?
Thank you. I think the Polyclinic does the VIA too. But for us, the reproductive health center, I was trying to be biased a bit of myself.
Right.
So
Okay.
forgive. Yeah.
All right. So
and
basically,
I know the other areas. Too,
right. Basically, so that's a procedure.
Sure.
If there are any irregular cells, they would be identified by this process.
Perfectly.
Which is cheaper, widely, broadly accessible to most women, irrespective of their social standing. Right.
Sure.
And then there's an early process. The cryotherapy
of intervention.
We can intervene if we see something at that stage.
Perfectly.
We're still not talking cancer.
We're still not talking cancer.
I like that.
Yes.
Okay.
You know, that's what makes, for me, that's what I love about when it comes to issues about cervical screening. Because at every point of the stages, you can truncate it.
Right.
Before it way advances to whichever level you have to give into palliative care, like the person to have a peaceful death. And so, this is just an aspect of it. But you know, for every procedure, there are levels and standards and techniques are being highly improved upon. And so apart from the VIA that could be done anywhere within the peripheries, there is also what we call the conventional pap smear, where we have a brush with a glass slide and there's something like a spatula that is used to I wouldn't use scrape to sound scary, but it's used to gently sweep on the mouth of the womb. And then the brush is also used for the a bit inner part of it. We call it the endocervix. And then we smear it on the glass slide. We try to put a preservative on it, and then that goes to the lab to further do the histological or the assessment to ensure that yes, you don't or you do have any changes on the mouth of the womb. And so that is what the pap smear that our women know.
Papa Nicholas. Yeah, after the guy who discovered. Right. It's a Greek name. Okay.
So that is that one. And so let's say that is the second after the next after the VIA. And a lot of times when you have any changes for this one, then the next thing you do is we have what we call the colposcopy. Colposcopy, for some people, they take it as an intervention. Others will use it as a part of a screening process. And so either way, depending on where you are standing and the space in which you are, you would appreciate the usage better.
And so colposcopy is basically imaging again.
Exactly.
Right.
Highly sensitive imaging to appreciate the extent of any change that could be there. And then if there is a need to take biopsy, a bite on the skin, the affected area, for any further intervention to also assess, yes, if there is a change, what is the extent of the change that is prevailing? And what can be done, because the extent of the change would help us to know the kind of further intervention to give you. And so that is also there. And then we come to the
just a sec before you go there, take a breather. As we digest what you've said. Let me remind listeners, this is Ultimate Health on Joy 99.7 FM with me, Nortey by nature. We're discussing cervical cancer awareness, and we're going deep down there. Yeah, we're looking at preventive screening. Why are we doing preventive screening? How do we do it? Who should be doing it? All right, and then what are the possible outcomes of screening? Right, we're screaming out loud that early detection is the imperative. Okay, so you need to get access to screening wherever it is, whether it's free, discounted, or not. Get yourself screened. This information is for men and women. Last week, a gentleman called in and wanted the audio because he said he needed to convince his wife. Right? I sent him the audio directly from my phone. He's yet to respond, so I'll find him and give him a knock. Right? But I believe he has used it. 26 minutes past the hour of 2 on Joy 99.7 FM. Any questions, concerns, experiences, please WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. Okay, Abeku is working on pushing the WhatsApp. I believe it's slowed down a bit, all right? But we'll get them, we'll read them out, and I will activate the phone lines in about 5 minutes. Okay, so we've done the pap smear. We've done the VIA, visual inspection using acetic acid. Right? Okay. And then you're moving on to another type of the screening procedure. Okay, what's that one?
Okay, so that one is called the liquid-based cytology sampling.
liquid-based cytology. Right.
So in this case, unlike, I mentioned even with the conventional pap smear, that the sample is smeared on a glass and then we fix with a preservative to prevent it from drying. This time, the sample that is taken, we use only a very friendly brush that serves both the inner part, which is the endocervix, and the ectocervix. So the inner part of the cervix, bit of the inner part of the cervix, and then the outer part of the cervix. And then the brush is used to sweep about 5 times, and then you wash whatever cells you obtain from the cervix into the reagent. Some people, depending on the design of their containers or their sampling bottle, you can't wash it in, and so you just have to break and drop in. I know some laboratories do that. Other laboratories too, they would expect that their protocol, you wash everything in and you assess. If there are still some cells in the teeth of the brush, then they would want you to break and drop in so that they do their own assessment as at the cytology level.
Cells are harvested, let me use that word, are dropped in a liquid reagent, in kind of suspension.
Perfect.
Right.
Perfectly.
And then that is later visualized.
Yes.
Right.
It's sent to the lab for visualization.
Okay.
And
go ahead.
Right. The interesting thing about that one is it's a very simple procedure. And there are times that, let me just quickly compare the two, the conventional and then the liquid base for us to see. With that same liquid base that you have taken, that same sample could be used for testing for the strains or the type of the HPV that could be prevailing in your body. So whether it's a high risk or the low risk, whichever one is there, and if there is any, it would also detect the type of strain that is present, so that if there is any form of intervention, it can be given to you. You are also assured that yes, if it says that you are negative, then over 90% it is telling you are negative and you can vaccinate, especially if you are within the ages of below 46 years. Some protocol go for below 46 years, you can vaccinate, as DES2 would do up to 26. But for our space, where of course now vaccine is now taken up, we go as far as to the 46 after you have screened and you have done the HPV and it comes out to be negative, or it comes out to be that yes, you don't have the strain that could cause the cervical cancer.
Great stuff. 29 minutes past the hour of 2, Ultimate Health on Joy 99.7 FM. I've been battling with a bit of a throat infection and a cough, right? So as I happily interact with Rose, I'm suppressing coughs and little things. But let me read a couple of these WhatsApp messages. Hi, thanks for the good work you're doing. How long does it take for the result of the pap smear to be ready? I did mine about 2 months ago, but the result is still not ready. This is from Theo, I believe. So is there a waiting period after you've done your PAP?
Sure.
And when should you get the results?
Great. So depending on the lab that had it done and the number of samples that were taken at the time, usually it ranges between a week to like 2 weeks. You should have your pap smear results. Yes. And so before the test, there is what we call the pre-counseling, the pre-procedure counseling, and then the post-procedure counseling. So the pre would help you to know exactly what to expect with the processes and even exactly what is going to be done for you, and then the waiting time, because sometimes for some people the waiting time can be very frustrating. That yes, I'm waiting for what I don't know the outcome is going to be. So that alone can be very terrible. But if you're able to talk them through the process, it helps to allay their fears and anxieties. And so I think she can call the facility where she had a test done to see. By now there shouldn't be anything that should prevent the readiness of the results.
Okie dokie. 055 11 11 997 is the WhatsApp line. Let me activate the phone line. 0302 221 6541. Rose from Tema says, please, can a virgin take the vaccine?
Excellently. And so we mentioned last
hang
week
on. The way you are smiling.
I am waiting.
Is it just because the person says I'm a virgin, is a virgin, and what has virginity got to do with it?
Great. So, that's what I was going to go to last week, an aspect of our discussion. We mentioned that provided you are certainly sure that there has not been any, you use, let me borrow your word, it's a digital approach or digital
manipulation.
Great, there hasn't been anything like that. So if you're certainly sure, of course we cannot test for that exposure because we are not looking at just penetration, but anything that has to do with that kind of engagement.
Okay.
So it'll be difficult
Your
to tell
hymen
with
might be intact,
Sure,
which
but you might
physically
have-
makes you a virgin, but you may have engaged
other engagement.
willingly or unwillingly
Thank you.
in certain things that could expose you to the
Perfectly,
HPV,
to the HPV,
and
sure,
therefore not
sure.
make you a candidate.
Sure.
See.
So in that case, yes, we're able to have that pre-counseling. We engage each other to find out, yes, are any of these things possibilities? Yes, if you really open up to us, then we'd know whether I mentioned even the baby speculum that could be used very friendly, and at times that we could even use a very tiny object, a sampling tool, to just take the sample without necessarily opening up, so that we can test for the HPV. Because the same swabs during the COVID, what were used for testing COVID could be used for testing the HPV, depending on the instrument or the machineries that are available within the lab settings for testing that.
Let me ask you a common one.
Right.
Can the procedure for any of these tests break a woman or a girl's virginity? Some people say, I had my pap smear done and therefore that broke my hymen. I have not been sexually active, or I have not had penetrative intercourse. Right? Can you answer that?
It is possible. It is possible because the instrument we're going to introduce there, it's a bit it wouldn't be too friendly for the one who has never had a sexual penetration.
Right.
And so especially if the person doesn't also open up to really inform you that, okay, I have never experienced this before, so that the provider would know exactly how to handle it. And so a few times I have heard of one or two people who have lot similar complaints. Sometimes, yes, you go to the hospital, you see the gynae. So in
that instance, Rose broke my virginity.
No, in that instance, a procedure, not really Rose, but there was a procedure that
might not be that understanding that, hey, I knew you to be...
but interestingly, it's not like well, when it comes
you're
to
still a virgin. I mean,
yes,
yeah,
because you don't need to argue this out with your partner to say that by all means. Because if I trust you, then I should trust you in that terms, unless otherwise we have other
don't mind me. I'm just making sure I ask all the things that are in your Stubborn Academy minds. Let me activate the phone line 0302216541. Ultimate Health on Joy 99.7 FM with me, Nortey by nature. I'm here with Rose Edufu of the Kolebu Teaching Hospital. We're talking about cervical cancer, screening procedures, vaccines, vaccination, and tests, and then treatments or interventions. All right. If you have any questions, concerns, 030-221-6541. Ultimate Health on Joy 99.7. Let me read a couple of them. Mabeku is now transferring them to my phone itself. Oh, you just sighed. Rose just sighed, though. You see, I give her a lot of pressure. Good afternoon, Nortey. Good afternoon, Nortey, once again. And how are you, Dr. Rose? I like that. I thank you once again about your educative program. Please, at your earlier point, you spoke about screening, and I would like to know if our national health insurance has cover for it. Or after the process, I will have to be giving a huge amount of money to be paid in case I send my woman for it. This is from Hayford in Bato.
Okay, so we're so pushing to we're still pushing to have national health insurance supporting screening, but there is really a system that supports the treatment, an aspect of the treatment modalities. So it is one of the things that I'm sure within the soonest possible time we're going to have it on the national health insurance, but currently it is not really supported. I remember before the COVID we had a very huge launch at the National Theatre, so that where we try to engage the people responsible in these sectors to ensure that, yes, within 2020 we'll be able to roll the cervical screening, all the cervical screening modalities onto the national health insurance. But it was again disrupted by the COVID, and of course I know that,
and it's not something I'll hear parliamentarians fighting about.
It is serious, it is serious.
So I have a caller on the line. Let me just break in there and get my caller before I lose the caller. Hello, good afternoon.
Good afternoon, Nortey.
Right, who am I speaking to?
Amy from La Paz.
Dennis.
Amy. Yeah.
All right, Amy, please share with us.
Yeah, I'd like to know why they don't use the Cervical for young ladies within 25 years, even though they may be virgin.
Why they don't use the Cervical, right?
Yes, yeah.
You're talking about a particular vaccine.
Yes.
And why they don't
use for the prevention?
Yes.
If you have not had any intercourse or something.
Okay. All right.
Thank you.
Yes, Rose.
Okay, so thank you, Emmy. We had Cervical some few years ago. That was imported by GSK or produced by GSK, but currently we don't have Cervical. So what we have is Gardasil.
Okay.
And so we have Gardasil 4 and Gardasil 9. Which are both equally highly sensitive in prevention of cervical cancer and a few other cancers related to HPV causation.
Right.
So with the Gardasil and then the Cervical, the baseline is that for as long as you are a virgin, even if you are 40 years, you have never had these descriptive things we are talking about, you're eligible to take the vaccine.
I have a bit of a challenge, and help me out, okay? When we emphasize virginity, especially for the older candidates or clients, whereas we're talking about exposure to a particular HPV virus strain, we may miss the point, right? Because I know people swear by their chastity and and therefore you could be exposed in different ways.
Sure.
Doesn't make you a bad person, but virginity comes with this judgmental posturing. Or am I wrong?
You are not wrong.
Right.
You're not wrong. So, interestingly, when we have to even relate it to the vaccination, there are some people who even they run the test and it comes out to be HPV positive or whichever strains could be there.
Right.
For as long as it is not the strains that the vaccine can protect against,
then
you can still take the vaccine.
Right, okay.
You can still take the vaccine. And so the emphasis is not too much on the virginity thing, but we want you to know, are you in any way sexually exposed in the context of all the descriptions
we have mentioned? So we're screening you for the risk variables as well.
Perfectly.
Right?
Perfectly.
Okay.
Yeah.
Great stuff.
And so the age, it is not actually true that we don't vaccinate people who are not sexually exposed and they are more than 15 years. For the Gardasil, from age 9 to 14, you have your schedule for your vaccination. And then from 15 years to 46 years. I mentioned earlier that, depending on the protocol here in Ghana, currently we're still doing that to age 46. So for those who are sexually exposed, you screen and then you can vaccinate.
Okay, I have a call on the line. Hello, good afternoon.
Hello, Mr.
Right, thanks for waiting. Is this Ajingo?
Yes, I was.
Okay, I'm sure you have about 7 questions. I'll take 2.
I'll cut it short.
I'll take 2.
With cervical cancer, I want to ask for the horses. These kind of guys, when they're taking something, they rush in with a woman, sometimes fingering them. It's like somebody going to eat and forgetting that he has to wash his hands. And also inserting some materials into the private parts. So some of the ladies, the one they place with ties and whatever. There's also some causes. And when you put something like dry ointment, can also have effect on this issue.
You see, you're asking questions, but you're making assertions. What's the second part? What's the second part? Something about ointment.
Some of the ladies, instead a lot of creams.
Okay. To make the place tight.
Yes, boss.
It's called secondary virginity.
Yeah, okay.
You would know. Ajingo, no. All right. Are you done? Thank you. Okay. So Ajingo is talking about certain. There's another caller. Okay. Hello.
Yeah, Amy is back.
Amy, yes, Amy.
Yes. You see, I personally asked my daughters to go to a Ridge hospital when they were around 24, 26. And they came back that they said they wouldn't, because I knew we have those vaccines, the Cervical at the time. And they were returned. They said they are older, and so unless they do the pap smear set or something before they can take the vaccine. That's why I'm asking.
Okay. So what? Just let me, out of interest, if you're willing to share, Amy. So did they go forward for the pap smear, or they still have?
No. They were not ready for that speculum or whatever to penetrate them and then break their virginity sort of.
Okay. Were you
so
there?
They said then they declined.
Did you go with them?
I didn't go with them.
Okay. All right. Let me get some response, though Rose is not here for the Greater Accra Regional Hospital. It looks like a more specific case, but let's see. Right. So she's saying that her daughters were around 26. They presented and they should have been, should I say, good candidates for the
vaccination.
The vaccination. She was aware that particular vaccine was available, but they were denied and asked to do a higher level of screening, and they declined that. Any comments quickly?
Anyway, I would want to say that I sincerely apologize that such a thing happened, but maybe everyone to recount back. Maybe we thought I don't want to hold brief for anyone. I don't know what kind of conversation went on between the
Why don't you just be like the vice president and say you and I were not there? We don't have the full picture
of it. That's why I said I don't want to hold brief for anyone, because like the issue of Cervical has been like quite some years ago, and so it would be really difficult to say that yes, it was true that they were turned off because of ABCD, but would still say that if the girls are still there, they can still access, be it Kolebu, Ridge, any of those health facilities, and then we engage them and see how best we can appropriately help them.
I'm glad you landed on that point, because my worry is that they remain unprotected as per what has just been shared with Amy. So let's see, maybe we could reach out and do something there. All right. 44 minutes past the hour of 2 on Joy 99.7 on the 4th in 2024. Plenty force, Abeku is looking at me. He's not smiling because he has a phone call. Improve your face. Hello.
Hello, boss.
Yes, am I your boss? I'm here for you. I'm your servant. Who am I speaking to?
Oh, you're talking to Mr. Foley from Nungwa.
Mr. Foley from Nungwa, you're welcome. Share with us quickly.
Oh, I just want to consolidate and add to the point that your invited guest was sharing with it. Truly speaking, you have been enlightened. And in Africa, the unfortunate thing is that we don't like going to the hospital. We go to the hospital when the situation is out of control. And we don't need to wait until we are sick before we go to the hospital.
Quite right.
Because it is not all disease conditions that exhibit symptomatic manifestation.
That's right.
That is why it is very important to visit the clinic after every 6 months for routine observation. So in a group, the guest has really enlightened us. But my only problem is that because she's talking to an ordinary average lady, some of them are not highly educated, I would have loved if she can speak rather next time an African English, you see, instead of trying to make her English look more scientific or maybe sophisticated, an African Ghanaian English would be okay.
You'll be amazed.
Thank you very much.
Thank you, Mr. Kofi Foley. You are one of our discerning listeners, and the others actually appreciate the level. In fact, sometimes we drop things and they know the distinctive mark of ultimate. So yeah, I get his point, but he's saying we should break it down and so on and so forth.
Try.
We joke, we break things down on ultimate health. It's one of the reasons why for some people, I slow my my guests down.
Sure.
Because I get them to stop and break things down, right? But well appreciated. He says we should go to hospital. Kofi also says that this nurse is really enlightening the public. The unfortunate thing is that in Africa we wait, or maybe Kofi is the same for
maybe the same person.
Yeah, we wait until we fall sick before we go to the hospital. And things, it's not all diseases that are symptomatic. Thanks. I will advise the nurse to speak an African English. You see, you are using symptomatic and all that.
It's serious, you know.
Kofi. All right. 47 minutes past your hour 2 on Joy 99.7 FM. Right? Boy. Okay. I'm having to do my WhatsApp on my phone instead of my usual screen. Can a female get HPV right after flushing the toilet and then peeing? Let me read that again. All right. Can a female get HPV right after flushing the toilet and then peeing? So you're talking about getting HPV what? From the toilet seat?
The toilet seat.
Okay, I understand viral particles spread from the powerful whoosh of a flushed toilet. So maybe somebody's used the toilet before you.
And then you went in.
It's been flushed and then you do your do. This is from Dede in Maryland.
Okay, so Dede, we mentioned where we can readily get exposed to this HPV. Yes, there are a lot of viruses, a lot of bacteria to say in such spaces, but each bacteria will give you a kind of disease. But this HPV context we are talking about, it is only sexually related. And so if you have not come in contact in any way sexually to with the virus, then there is no way you should have the HPV. And like it was unlikely, and like it was mentioned earlier, that yes, you could get exposed or to the virus, but this virus over a period your body can handle them. It's only a few of them, like the type 16, the type 18, the type 6 and 11 that we listed the last time, that could at a point still be persistent. Even that one, depending on your immune status, you are able to manage without advancing to getting diseases. So that is why we are talking about the screening at this point. But such spaces will not expose you to the HPV.
0302-216541. WhatsApp is 055-1111-997. We're live on Facebook and YouTube. Ultimate Health, your ultimate guide to healthy living. We're talking cervical cancer, preventive screening, vaccination, test, treatment, and beyond. If you have any questions, you can still squeeze them in before 3 p.m. My guest is Rose Edufo with the Kolebu Teaching Hospital Reproductive Health Center. And we're going into details, and we are doing Kokomemle English. Right? But if you have any questions or something's not clear, feel free. Send them. Even after I leave the studio, I always ask Abeku, copy anything that comes in, and then maybe I can forward it to my guest.
Sure.
Hello, good afternoon. Hello. Let me see now. I'm using... Okay. I notice she's politically cautious in answering some questions, especially with lab results pending after 2 months. Even if the test was sent to the North Pole for evaluation, should it take that long? I think... No, wait, hang on. Okay. This is from Dede. Dede, please. My guest said emphatically that normally 2 weeks, and she actually encouraged the person who shared that to call the center. She's not at the center. She's giving us a general talk on cervical cancer and testing. And I think she was quite clear on that. I mean, to be fair, I don't think she's being defensive. But what do you have anything to say to that? Because that was about the woman,
exactly,
the pap smear that has
lingered like 2 months, and I mentioned maximum a week to 2, unless otherwise even the samples are overwhelming.
I'm looking for that one
during the period of this huge numbers of screening, but even that it could go for like 3 weeks. So I emphatically said that if you could please call the facility so that they would feed you with the outcome of the result, because it shouldn't ever be that you should do a test and then over a month. And I mentioned even how it can be frustrating waiting for your result within 2 weeks. So talk of 2 months would be too unfair to have you like that.
Can a wife get the virus from her husband, and can a husband also get it from his wife? We did that last week.
Yes.
No.
So what we said is that yes, the virus can be a man being a carrier, giving it to a woman, or another woman carrying, giving it to a man, and so either the cycle could continue like that.
Essentially, sexually transmitted means sexually transmitted.
Perfectly.
Marriage, signing at the registry, whatever, doesn't change that. Okay? And we're talking risk factors and causative agents. In this case, HPV. Okay? So you can.
Only transmitted through sex.
Yes.
And so multiple sexual partners. And the mere fact that you have ever had sex, sexually exposed, puts the woman at a risk of getting the virus. Irrespective of who she got exposed to, you have a chance of getting the virus.
But I know where that kind of question is coming from.
Okay.
Right?
Okay.
Me and you are married.
Right.
And then there's an infection. Everything.
But we mentioned it's not about like, yes, we're married today, and so that is it. The thing is, I mentioned you could have the virus today.
Listen, Rose. I'm doing the practical thing.
Sure.
You and I are married. Okay?
Exactly.
We've been fine.
Perfectly.
For a long time. Okay. Incubation period. So what the person is really saying is that, well, this thing has come. I want your program to clarify. Is it possible? We have clarified.
Sure.
It is possible.
It is possible.
The other details are, right, are what needs to be looked at. Because a lot of times when they come to the reproductive health centers, disclosures are difficult.
Very.
In fact, sometimes even bringing your partner is a challenge.
Huge
For some,
one.
a huge one, right?
One, sure.
That's why I love questions like this, because they allow me to, show all the things, angles that you have to deal with. You have a client in front of you in a clinic who you have no reason not to trust.
Perfectly.
But you will go through your protocols to get dependable, valid results and information.
Exactly.
Right? So I hope you also appreciate, listeners, that when you go to a clinic, yes, there are tests that can reveal the footprints of various disease processes, but it is also needed when you are, giving history and other things that you disclose, because you could shorten a process. We could be dealing with something very serious. But
when you're hiding information, it makes it very difficult to really get solution for you.
Yeah, it sounds like a funny message. Nortey is messing with it, but I know where I want to drill it to.
Perfectly.
Right? That you have to disclose, and in many of the cases, you may be required to come with your partner.
Is it necessary?
Right. Great stuff. Kind of wife. Okay, I've done that. All right. Have I cleared the? Yep. Okay. 03022216541. So we've done liquid based. We've done the PAP.
The PAP. We've done the VIA.
Okay.
Sure.
We have about 5 minutes.
And we mentioned some aspect of colposcopy.
Yes.
Yeah.
But with these tests, how should and how are results communicated?
Okay. So every institution has its own protocol to result disclosures to their client.
Just a second, sorry. I'm seeing this. I've been looking at my handset now. It's back on the screen. Ajiman Joseph has said he asked about fingering and all that. And again, we've talked about sexual activity and HPV. Okay.
Exactly.
He asked about ointments to tighten down under.
Great.
And could that be related?
Great. I think we missed that. Sorry, Ajiman. So on that one, it wouldn't be related to the HPV. But the unfortunate thing is that a lot of some of these substances affect the immune system, your body's immune system. And so one of the risk factors we mentioned is immunocompressed conditions. Yes, we mentioned HIV, but if there is any other thing that is breaking the protection within that space, then it rather puts you at risk of easily getting exposed to the virus.
Right.
Meanwhile, if maybe these substances were not there, or the whole body is highly, the immune system is high, then there is a less or slim chance that the woman who could even be the carrier of the virus could have it advancing speedily to another level.
Okay.
So I really think that, yes, it will not...
Be mindful what you're putting down there.
Yeah.
Right?
Very necessary.
It's
very necessary.
It's a self-cleaning
space.
Self-maintaining space.
Sure.
Right?
You don't need to wash the
there are several
plates,
products claiming certain things, but we've done this before. And like I said, I will assemble the Charlie's Angels and we'll look at what you should be doing down there, what you shouldn't be doing, etc. Yeah. Okie dokie. Hi, Nortey. Since men don't have cervical cancer, if they have the HP virus, what cancer does it lead to and how does it affect them? Ernest in Abeka. We talked about this last week, but hit
we'll
that
repeat
again.
it. Right. So we mentioned it could result in the cancer of the penis, and then the man also could have a cancer of the throat, and then any cancer, sometimes cancer at the back of the mouth. So for as long as you do not have the cervix, yes, you won't get the cervical cancer, but you can get the penile cancer, and then you can also get cancer of the throat from the same virus.
Right. Did it comes back? Mentioned dildos or vibrators last week. That it could put one at risk for HPV.
Perfectly.
She wants it explained further.
Okay. So any substance, apart from even the dildos, any substance that has been, let me say, contaminated, being used by another, and you're going to use it, or it has not really been cleaned well. Sometimes we think, because this is not like a direct person to person that is being used, I shouldn't get a virus. But another person might have used it, or you are using it alone. How well is it cleaned? And so for as long as it's not properly cleaned and then you use it, you're likely to reinfect yourself. Right. And so that's why we're saying that, yes, Adjoa has used it, AC is using it in that kind of way. You can easily get it.
Adjoa and AC, don't call in. It wasn't me.
Forgive.
Right? But yes, essentially, if you're sharing sex toys and other things, be mindful. Some of these reproductive
viruses,
fluids, and if they have viruses or anything, then you are facilitating the transmission.
Perfect.
Okay, and sometimes also, all my HIV work is coming back now. But the use of these things also, should I say, damages the surfaces. The reproductive surfaces are pretty sensitive. You make them rough. You open up for little cuts and lacerations. And that heightens the transmission.
Creates favorable
of
environment.
So be mindful. Ajiman okay said, I said Ajiman okay. Ajiman Joseph says he's okay now.
Yeah.
We've answered the fingering and the ointment part.
Great.
I'm sure Ajiman Joseph has more. Right?
Yep. So
just have 1 minute left. Yeah, go ahead.
I think before we end, so from this time going to 2030, WHO is advocating, pushing and challenging every region to a large extent to ensure that about 90% of their adolescents will be vaccinated with the Gardasil or the whichever vaccine is available against the HPV, and then about 70% of the women.
So we have targets for vaccination.
Target for vaccination, 90%.
Okay.
And then those
who go that again. Slow down. 90% of
our girls by age 15 should be vaccinated. By age 15 should be vaccinated. And then for women who are sexually exposed, about 70% of them should be screened with the appropriate screening tool, like we have just elaborated.
Right.
Yeah, and then 90% of the women who have the virus, who have the disease, will be appropriately managed and treated as per their resources available.
It's like the goals we set for HIV.
Perfectly. So now this goal is 90, 70, 90 by 2030. And so that's why for us we're saying that yes, the only thing we can do is to talk about it, give information, encourage you to come and screen, encourage you to vaccinate the young ones. If you think that the resources cannot meet the adults, screen for them and then vaccinate the young ones. And then please, early detection always saves lives. So we don't need to wait till you see any sign before you come. We want you to come. Let's do the screening. If there is anything to do to help you, we can properly do to intervene so that you don't get cervical cancer.
Right.
It is the only preventable cancer anyway.
Thank you, Rose, darling, Doko, sweetie pie, honey, sugar. But great stuff. She's with the Reproductive Health Center in Kolebu. They're running discounted screening till March.
Till 30th April?
No, 30th April.
So starting from tomorrow,
all right.
5th of February. 5th February.
We will do subsequent programs on those who actually have the cervical cancer. Right? We promise.
Great.
We will do programs on those under treatment and so on, because we do a lot of that with regard to breast cancer.
Perfect.
All right. So many of you are calling for us to stick and stay on that
experience,
so that do people get cured and this and that, and that will definitely Ultimate Health will undertake to do that. Many thanks, Abeku Kofi, my producer. Many thanks to my throat for not pushing me to cough. And we'll be back again next week with another easy to digest African English.
I know, right?
Edition of Ultimate Health. All of you, my listeners, my WhatsAppers, and everything. Hey, Ultimate Health is going to be 21 soon, and we're trying to see if we can make noise small. But Abeku hasn't promised a showdown yet.